How is periodic limb movement disorder diagnosed? Have you ever wondered how doctors figure out if someone has periodic limb movement disorder? This condition can really affect sleep wellness, so understanding the diagnosis process is key. Periodic limb movement disorder, often linked with restless leg syndrome, is diagnosed mainly through a sleep study called polysomnography. This test is the gold standard for spotting and measuring those pesky limb movements that happen during sleep. During polysomnography, a patient spends the night in a specialized sleep lab. While they sleep, several important body functions are monitored continuously. This includes brain activity, muscle activity, heart rate, breathing patterns, and even eye movements. The muscle activity is recorded using a method called electromyography. This is where the repetitive limb movements, usually in the legs, are tracked. For a diagnosis of periodic limb movement disorder, specific criteria must be met. Doctors look for periodic limb movements occurring more than 15 times per hour during sleep in adults. They also check for symptoms like poor sleep quality or daytime sleepiness. The movements themselves are typically short, lasting between 0.5 to 5 seconds, and they happen in series with breaks of 4 to 90 seconds in between. Sometimes, video monitoring is used during the sleep study to visually capture these movements. In addition to the sleep study, doctors may conduct blood tests to rule out other conditions that could cause similar symptoms. Common tests include checking for iron deficiency, anemia, or issues with the kidneys or liver. A complete blood count and serum ferritin levels are often evaluated. While there are wearable devices that can track leg movements, known as leg actigraphy, these are not reliable enough to stand alone for a diagnosis. They can sometimes miss the frequency of limb movements and should only be used as a supplementary tool alongside polysomnography. Doctors also take a close look at the patient's medical history and symptoms. They ask about any issues with insomnia, twitching during sleep, or feeling excessively sleepy during the day. Risk factors such as being over 70 years old, having iron deficiency, or taking certain medications are also considered. From a sleep wellness perspective, getting an accurate diagnosis of periodic limb movement disorder is essential. If left untreated, these limb movements can disrupt sleep quality and lead to daytime fatigue. By identifying the disorder through polysomnography, targeted treatments can be implemented to improve sleep quality and overall wellness. This highlights the importance of thorough sleep assessments in maintaining healthy sleep patterns.